Tennessee Death Row Dogs, your local dog rescue nonprofit. Talkopolis, the social media TV network for your city.
Hi guys, Kane Harrison here. Welcome back to our incredibly informative segment. We're here with Dr. Gingrass and Dr. Haws from the Plastic Surgery Centre of Nashville. And we're talking about mummy makeovers. Welcome, ladies.
Thank you.
Now, we've covered a whole bunch so far, but we do have a couple more left, and we're going to talk about breast implants. So let's get started. Who needs them? Who doesn't need them?
Well, again, pregnancy causes a lot of changes of the breasts, and women will come in complaining that they've lost size or lost volume, or that their breasts are more droopy. Those are probably the most common things that people come in. And not everybody needs a lift, and not everybody needs an implant. So we'll take each individual patient and really try to sit down and decipher, do you want your breast to be bigger? Are you wearing a padded bra? And do you want your breast to stay up when you take your bra off? So those are the kinds of things that we have to examine each individual patient for and decide, do we want to put a breast implant in? Do we want to do just an implant, just a lift, or a combination of both, which is very common.
And you know, it's kind of like we talked about with tummy tucks. It is a continuum because number one is what the patient anatomy has, number two, what we can do, and then number three, what does the patient want? What's their ultimate goal, and how best do we get to that? So.
Right, and imagine, I think we've talked about this incredibly popular procedure. Do you think it's something, I mean, people kind of put in, the back of their mind that they would have after they've had their baby, sort of count on it?
I decided to have a breast augmentation after I had my children, and then I had a surprise at 43. So I've had it both ways. I've had a pregnancy without implants and pregnancy with implants. And I wish I would have done it before, in retrospect. Because I really was under the impression, even being in the field that I'm in, that it's better to wait until after your babies. And depending on your anatomy, I think a real small-breasted woman with kind of tight skin, she's going to do just fine having a breast augmentation before pregnancy. Someone who has a little bit droopier breast just naturally may be better off.
Oftentimes we'll tell women, if you know or if you plan on being pregnant within the next year, then wait, because your breast goes through so many changes with the pregnancy. But if you know it's going to be a couple of years, then why not have the breast you want now? Because we know they're going to change during pregnancy, but it's anybody's guess how they're going to change.
Do you think in the general community that there's a misconception about having a breast implants prior to the pregnancy due to nursing?
There's a little bit of that.
People have questions about it.
Absolutely.
You can definitely nurse if you have breast implants, and really there's not much contact with the implant and the breast tissue, to be honest. Oftentimes the implant is under the muscle and doesn't really have all that much contact with the milk producing tissue, so to speak. So it's most of the time, if you are going to be able to nurse, which you don't know that everybody doesn't successfully nurse, you usually can nurse with an implant.
And I imagine this is one of the procedures where you see the self-esteem of the patient skyrocket. Talk about that a little bit.
I just tell people, before I had my implants, I remember to wear that sweater, I had to have that bra clean. And if I couldn't find that bra, then I couldn't wear the sweater. After you have breast implants, whatever bra, whatever sweater, everything looks, everything fits. When we talk about having implants, when I got my implants, I had two things in my closet that didn't fit. Everything else fit better after. And I just think your breast ought to be able to match your butt is my goal, personally.
I mean, I just remember feeling like I was taking my breasts off every night when I would be wearing a padded bra, and I felt like that's what made me proportional. And, it was just really refreshing to not have to take your breasts off and put them in the drawer.
Yeah, women who work
and get
really
them back out
hard
again.
to keep themselves in shape and ought to be able to wear a cute triangle top bathing suit, or ought to be able to wear a sundress, a halter dress. And they can't, because unless you have the camouflage bra, you can't wear it. So you can't wear a triangle top.
And also, I imagine there's a lot of smaller framed women who then get pregnant and their milk comes in a nurse, and then obviously that changes as well, and they realise, hey, I actually liked the way I looked when I was pregnant. So how many of those sorts of clients
I'll
do you
actually have people come in with pictures of their breasts when
Yes,
they were pregnant
yes,
and
absolutely.
say, I loved my breasts. They were this size, such and such a size, and this is my goal. And that can be really helpful. So
Absolutely.
but unfortunately, with pregnancy, and once you are done and your weight stabilizes, most of the time they're smaller than they were to begin with, which is a really frustrating thing. A lot of women just come in and say, I want my boobs back.
Yeah.
I just want them back.
I don't really want necessarily to be, big. I don't want them to be noticeable. I just want to feel proportional.
Yes.
Sure. Well, thank you so much again. We've loved this little segment that we've been doing
Thanks for having
about
us.
mummy makeovers. And of course, you guys, you can make sure you jump on and like the Plastic Surgery Centre of Nashville, and of course jump on Talkopolis and like that so you can see more of these guys. We've so much enjoyed having you on. Dr. Haws and Dr. Gingrass of the Plastic Surgery Centre of Nashville. Make sure you send some comments in if you've got some questions for the doctors, and perhaps in the next segment we can cover that and get a great relationship going with you guys, the viewers. So thank you so much, and we'll see you next time.